Hi, I'm Yaffi Lvova, registered dietitian nutritionist and owner of Baby Bloom Nutrition, babybloomnutrition.com. I do personal one-on-one and small group counseling for any nutrition obstacle between pregnancy and toddlerhood. So you can check me out on Facebook right here or on my website, babybloomnutrition.com, on Instagram, babybloomnutr, and Twitter, which I haven't started really using yet. And hi, Paula. Looks like you're on time today. That's exciting. It's kind of our thing that you come in at the end of it. Anyway, so come follow me. Pinterest. Pinterest.com/Yaffi, Y-A-F-F-I. Today we're talking about reflux. So most of this is going to pertain to infant reflux, but some of it's going to pertain to adult reflux if you're on medications. So first, what is the definition of reflux? Well, reflux is when something that's supposed to stay in your stomach comes out into your esophagus. And for adults, often that's painful. It happens a lot during pregnancy for hormonal reasons, or it could happen related to certain foods. Some people get reflux from high-fat foods or caffeine, although it could differ depending person to person. And with babies, that's about the same. There are some common food causes of reflux, but you really do have to find what your baby's trigger is and figure out how to manage it based on that. So it's when food backs up from the stomach. Normal, regular spit up is actually reflux, and it's not a problem. A normal, healthy infant can reflux multiple times a day. It generally clears at about 18 months, and it doesn't really indicate anything. People are used to baby spit up and thinking that it's normal. It's when it's excessive or possibly causing damage, which is actually pretty rare, when you want to be concerned. So I want to talk to you about when to be concerned and what causes reflux. So causes. Your stomach is like a bag. And on the top of the bag, so you have your esophagus here, and the top of the bag is the lower esophageal sphincter. And on the bottom of the bag, you have another sphincter that goes to your intestines. And so these close, ideally. And so they hold like a Ziploc bag that has two zips. Holds the stuff inside the stomach so that the stomach can shake around and mush up all your food. So the stomach's purpose is, number one, the inside lining of the stomach is kind of like one of those old-time washboards, and it grinds up your food. The other purpose of the stomach is to the gastric juices, which is gastric acid along with some enzymes, is actually to start digesting the food and to mainly wash off the food. The main purpose of the stomach is to use the acid to wash off your food to make sure that that you're not transmitting any pathogenic bacteria. It cuts down on food poisoning, and that's the purpose. So that acid does really have a purpose. And Paula says, mine doesn't close all the way. Fun stuff. Yeah, that's not really fun. I'm sure you're being facetious. So yeah, there are certain health issues as adults where you may have reflux. If your esophageal sphincter doesn't close all the way, then you're going to have that reflux, and that could cause pain as we get older. So other causes of why, the lower esophageal sphincter, which is the top part of the stomach, which holds everything inside and keeps it from refluxing up into the esophagus, it's not that mature yet, especially if you've had a baby who's premature. That's going to be one of the things that's going to develop later on. And that means that you're going to have more spit up than usual at the beginning. Babies who are lying flat or have a food intolerance also may show evidence of reflux. Usually it's not a concern. I will get into when it's a concern and what's that called and what causes the actual reflux that could cause a concern. Doctors may prescribe medication for this. The common ones are Prilosec and ranitidine. There are two different ways that reflux medications could work, and there are two different classes of reflux medications. One is a proton pump inhibitor, PPI, which actually inhibits your body from producing that acid. It's still going to produce some acid, but not as much. And the idea is that if you have less acid in your system, then as it refluxes into the esophagus, it's not going to cause as much pain and inflammation and damage. And that's assuming that the reflux is causing any damage, which in a baby is not really a safe assumption. The other type of reflux medication, which is more like when you're thinking of Tums, for example, is you have produced that acid and you're taking the medication to neutralize the acid. Either way, you don't have the proper amount of acid in your stomach to wash off the food, which means that you are more likely to have some kind of food reaction, like a food poisoning, for example. The problem with these drugs is that they interfere with digestion. And that's really the purpose, is to decrease the acid in your stomach. But what that does is it inhibits your body, it prevents your body from adequately absorbing specific nutrients. Protein, calcium, and iron are among those nutrients that are not going to be absorbed very well. Calcium requires acid in order to be absorbed. Just under the stomach, where the small intestine starts, is where calcium is absorbed, and it needs that acid in order to be absorbed. It's going to change your microbiome, which the first 2 years of life, an infant is really developing their immunity by establishing the gut bacteria. And that's why I'm always pushing for probiotics, because it's really important to get that microbiome, the gut bacteria, healthy, because it sets you up for a lifetime of digestive health. And taking some of these medications really prevents your body from establishing the proper immunity at the gut level. I feel like I'm getting really sciencey here. So it increases your risk for food sensitivity because you're not absorbing food the way you're supposed to, and it's preventing your body from having the right bacteria in your gut in order to make for your immune system. You're also increasing your risk for intestinal and respiratory infections. Well, really all infections, because of that microbiome issue. Other ways to handle reflux. As I've said, it's often caused, really very often caused in babies by a food. And the most common foods are dairy, beef, and eggs that are causing reflux. So what you want to do is experiment with the diet. See if you eliminate these foods, if that's going to affect you, if that's going to affect your infant in a positive way. So you might say, well, I'm breastfeeding my infant, or I'm formula feeding my infant. How do I manipulate their diet? Well, if you're breastfeeding, you want to eliminate that from your diet and see if that makes a difference. Unfortunately, it can take a little while. Dairy takes 10 to 14 days for those proteins to get out of your body. And generally, if an infant is reacting to something, it's a protein. Oh, Daniel needs me. Hold on. Oh, the hat. Come here. Okay. And now we have a baby. So if you're breastfeeding, you want to eliminate that food from your diet to see if it's going to make a difference, but you're going to take 2 or 3 weeks in order to see 100% difference. If you are formula feeding, you may want to consider switching formula to a different non-dairy, or if it's soy, non-soy. There are different issues, and if you are experiencing some health issues related to your infant's diet, you may want to consult a professional. This is something that I do. I can help people to figure out what's working best to help to clear certain health issues like this. I have a question. What does that mean for babies? Meds causing future gut issues. I know some people are super pro-meds on babies and some are totally against them. It's really good that these medications exist, but I think that much like antibiotics, they are way overprescribed. If your child has reflux, it's not necessarily causing a problem, and if it is causing some damage, you can handle that in a more natural way without the medications. Eliminating dairy from your diet, for instance, is not going to have an adverse reaction in your child, whereas giving some of these medications will have an adverse reaction. Some people are even giving their children surgery to correct for damage that's been done by reflux, when really, if you catch it on the beginning, if you can prevent some of the damage. So other ways to handle are to feed the baby more frequently, interrupt your feedings to burp. A lot of people know that when you're breastfeeding, for example, you feed one side and then burp the baby and then feed the other side. You would ideally have a good burp in between and after both sides. If you're feeding with a bottle, you want to imitate how a baby would feed at the breast. You want to feed slowly. And sometimes the nipple size on the bottle is going to cause too much air sucking. So if you have some reflux, you might want to check with, to see if changing the size of the hole on the nipple is going to help you better. There are different sizes to allow for different rates of flow, which will increase or decrease the amount of air that your child is sucking, and more air means more reflux. Holding your child upright for 20 to 30 minutes after feeding. That's fun overnight, but it really does benefit because the air is going to rise to the surface a little bit better, and you're not going, okay, bye Paula. The air is going to rise to the surface a little bit faster, and it'll be more efficient, and they're not going to reflux later with that gas coming up when they're at a bad angle to handle it. So a lot of people have a happy spitter. Daniel here is a happy spitter. They spit up, but it's not painful for them. They're perfectly happy, content children who are growing at an expected rate, feeding nicely, are not irritable after feeding, and yet they spit up a lot. And that is a happy spitter. You're not having damage. They have a lot of spit up, and it's not causing damage in their system. When you should be concerned is when there's poor growth. And I do have a nap time nutrition. You can look back in my video archives on Facebook for my nap time nutrition that I did based on the growth charts. If your child is not growing as expected, there is a concern for that. There could be gastroesophageal reflux disease, GERD, which could be causing damage, or eosinophilic esophagitis, which is it's a condition where they're reacting to multiple foods, or pyloric stenosis. These are things to discuss with your doctor. If there is a growth problem and they're experiencing reflux, your doctor will most likely pick up on it, but it's often best for us to be our own advocates. If your child has consistent projectile vomiting or spits up green, yellow blood or coffee ground color and texture, that's something to discuss with your doctor as soon as possible. If your infant is refusing to feed, has blood in the diaper, is showing difficulty breathing or has a chronic cough, or begins spitting up after 6 months old, or is irritable after eating, you want to talk to your doctor about that. You want to have a good team ready to help you. You want a lactation consultant, a dietitian, which is me, and your pediatrician, and you want to be your own advocate. So that is my talk on reflux. So if you have any questions, comments, or experiences, please comment below. I don't have a topic for next week yet, so please comment with that as well, what you have questions on, what you think I should cover. And find me on Facebook, Instagram, and Pinterest for lots of fun meal ideas. And thank you, and see you next week for Nap Time Nutrition at 1 p.m. Arizona time, 3 p.m. East Coast time, and 9 a.m. tomorrow morning, New Zealand. Thanks.